Uh, thanks, Kay. Let's go ahead and get started. Um, Hi, everybody. It's 3 minutes past the hour. Welcome to our July Cost Growth Target tag meeting. This will be sort of a quick meeting for tag. As you can see, we've got the first hour. I don't think we'll actually take up the first hour, but we've got some program updates to bring to you all and discuss very quickly. And then, as you'll see in the agenda, the last hour of this tag, 11 to noon, we're actually reserving for data submission office hours. This is for technical payer staff that are submitting the cost growth target CGT1 file to us this September. So that is covering spending in calendar years 2022 to 2023. All right, and as before, I think most folks are used to this now. We're not doing roll call. If you would please make sure your profile has your name and your affiliated organization. That helps us keep track of attendance, who's coming, and who's asking questions if folks are using the chat. So here is the agenda for the day. We just got some program updates. We do want to bring some data submission reminders to the group, and then that's it. If OHA folks have something to add, go ahead and take yourself off mute and verbalize it, because I can't. I don't think I can't see your faces, and I'm not sure if I can see hands. All right, let's just roll through some program updates here. So if you are keeping up with our advisory committee meeting, we've had two since we last met, the May committee meeting and the June committee meeting. In May, they discussed the annual report. And shortly thereafter, we had the annual public hearing, the Cost Growth Target annual public hearing on June 4th, and that was hosted by the Oregon Health Policy Board. If you'd like to see the materials or a recording of the public hearing, it's available on the Oregon Health Policy Board website. The advisory committee had their June meeting later in the month as a hybrid meeting, so virtual attendees and in-person attendees in Wilsonville. There are a couple advisory committee members moving off the committee, and we had new people come on. So I think we'll give an update about who those people are in the next slide. But new chairs were elected, and that June meeting had a really interesting presentation from Health Share of Oregon and Central City Concern. So if you'd like to see that really interesting presentation, feel free to do that. It was on the behavioral health system and the interaction between substance use disorders, mental health, housing, a couple different social services. In July, actually just yesterday, the advisory committee met again, and in that meeting, which just happened, so we didn't have time to insert text for this meeting. You could see those materials posted online, but in that meeting, they discussed cost drivers and strategies that certain organizations were implementing or trying out, and how to scale those up. On the next slide, we can see here are a couple folks. These are actually new advisory committee meetings. So I'm not going to go through the list, but you'll probably recognize a couple of them. The new co-chairs, Felisa Hagen stayed on, and then Jeremy Vandehay from Pacific Source was also elected as a new co-chair. And then we thank Peter Davidson, Lawrence Fernstall, Nick Powers, and Shannon Saldivar for their work on the committee. They were the departing members. So moving along, rulemaking update. So some of you may know we completed our rulemaking. I believe there were 5 racks, 4 or 5, I want to say 5. There were a lot of rules advisory committee meetings for the new round of Oregon administrative rules for this program. These were, just to refresh people's memories, these were rules that are outlining what the performance improvement process looks like, what financial penalties looks like, so the accountability part of this program. You could see the draft rules at the link there. It has just been, the Secretary of State website has just updated, so it's online too. There are other resources on that web page. If you'd like to see a draft of the red line text, what's been changed, and also I believe there's a summary on RAC member comments and what was incorporated, what was not incorporated. As a part of that rulemaking update, there is a new frontline worker data collection happening this fall/winter for not all, but some provider organizations. So in that rulemaking, members advocated for this data collection, and so we OHA staff will be reaching out to organizational contacts very soon, actually, about this new data submission. This is a September, annually it's going to be a September fall submission, but for this year, since rules just came live, we're going to push it back. So for this year, it's a December data submission, and we'll reach out to provider entity staff about that in a couple days. So watch out for that if this is relevant for you. I guess I'll also note there is going to be a short webinar for staff recorded and released, and we'll also have office hours late summer, fall for staff that are compiling this data submission. It's a fairly straight forward frontline worker compensation data submission. All right. Here are some educational webinars that may or may not be on your radar. So you'll also be able to find these and recordings of past webinars on the Cost Growth Target Advisory Committee website. The ones we just had were the payment arrangements and value-based payments educational webinar in June. Coming up in August, we are having an overview of the 2024 hospital payment report. And these webinars, I think we just started them this year, earlier this year, for advisory committee members, but they're public. They're for anyone who wants to know a little bit more about what's going on. So if that is you, please visit the advisory committee website. So related to payment arrangements and value-based payments, there was an educational webinar, but if you want to just go straight to the dashboard, here it is. So this is the updated dashboard. So keep in mind, it is up to 2022 data, calendar year 2022 data. And you can check out, these are the payment arrangement files that payers submit to our APAC program, detailing dollars in certain, not just value-based payment contracts, but also fee-for-service as well. So there's the link if you would like to see. And I think that is it for updates. Does anybody else on my team on the OHA side want to add anything? Okay, let's get to it. All right, so we have a couple data submission reminders and a question for any staff that happened to be on the line. So after speaking with a couple payers, and I believe this was only CCOs, but also interested to hear from commercial folks as well. We just wanted to give a reminder that member auto assignment to a primary care provider or home ought to go, the attribution tier ought to be tier 2 contract arrangement. Tier 1, we're reserving for members actively selecting a primary care home. But we also had a question for folks on the line, and I'm not sure, I don't even think I can see how many people are on this call. Okay, there's a couple of you here. For payer staff on the line, and I guess specifically for CCO payers, are you able to distinguish between folks, members who actively select their primary care home versus those who are auto assigned? We heard from one CCO payer that they are not able to distinguish this difference, and was wondering about others.
Hello, this is Wade Penner with Intercommunity Health Network, and I will say we are not able to distinguish between the two.
Okay, okay. Any others?
There's one in the chat that says, yeah, Julianne said that they also can't. Trang.
Thank you, Sam. Sorry, I just tried to be discreet.
That's fine. And I think Jeremy also agreed in the chat. So looks like can anybody actually distinguish? Maybe be the better question. It seems like most people can't. Can anybody actually make that that difference? It's like a no, Trang.
Okay, all right, that's interesting. I think like we kind of assumed people would be able to distinguish, but it looks like most CCOs can't, or at least the ones we're hearing from today.
Mm-hmm.
Okay. All right. Well, I think we will we'll maybe reach out specifically to our CCO contacts just to underline this point. And maybe think of, yeah. Okay. All right, thanks. We were curious about that. All right. The next update we have, well, it's not really an update, it's a reminder. Payer staff, we know a couple of you are starting to pull your files together for this, I almost said December, for this September. A reminder to double, triple, quadruple check that your demographic factors that you are applying to members for a measurement year, for a calendar year, you're using the member's age at the end of that calendar year. So for members in calendar year 2022, whatever age they were on December 1st, 2022, that's what you should be using. This came about because we had a payer pretty late in the game. We had already published our annual report, realized that they didn't do this. They used their age of the next year in their file. And while the numbers haven't changed and it doesn't significantly change the dollars or any. Again, this is just the demographic factors. It does tweak the PMPMs for their provider organizations further downstream. And when we are assessing whether an accountable entity is meeting the target, we are using adjusted dollars. So this fix, they did give us a file right away. This revision did affect a couple provider organizations, and for 2, they actually changed their performance. And it was a change, in favor of the organization. They better met the target, but this was a little bit of a scramble for us and for them. Everybody's been contacted. We are going to release a new report giving those updates. So we hope to do that in early August. And again, this is because OHA, we don't have member level data, so we rely on payer staff to compile and aggregate everything. And while we can see, your aggregate demographic factors in your stage 2 outputs and such, we could only pinpoint, hey, the trend in your demographic factors increased quite a bit, or it didn't increase. We can see things like that and bring them up to you in the data validation meeting. But we rely on payer staff to really double check that work. And this is something we are building. It's something we noticed when we had our data validation meeting, but now we are making a new internal validation check. So if your demographic factors look a little bit wonky to us, we will be having your staff go back and check that everything is okay. So luckily it didn't change the data overall too much, except tweaked a couple PMPMs. But Sam, do you want to add anything, or anybody else on the line? Yishan, Margaret?
No, I don't think so. I assume most of the submitters, the data submitters they have the birth date, and they're just they need to make sure they're not using the same age for both
Mm-hmm.
the base calendar year and the next calendar year. I don't think I think we know what to kind of look for now, but again, like Trent said, we don't have the data access that you guys do. So we really appreciate you all doing a lot of the legwork on this, and if you have any questions, that's what we're here for too. So appreciate it.
Any questions from people on the line about
Train, Julianne had a question. She wanted to know when the new report will be released, if we have a date.
Oh, we don't have a specific date. We're, I think, likely early August. Yeah.
Which is next week.
Yeah.
I think if any of the providers had a change to their results, I think we already contacted them that put them under or over.
Yeah.
So if you weren't contacted by us, there probably aren't going to be any significant changes to your results.
Yeah. All the provider organizations that were affected have already been contacted, updated data summaries with slight PM changes. And I think I mentioned before, only 2 organizations had their performance actually change. Like they went from not meeting the target to indeterminate, or they went from indeterminate to met the target, if that makes sense. Okay. All right. Well, it's data submission season, so our email is always open. If you, your staff have questions, feel free to email us. We also have 2 office hours. The first one is going to be today, 11 to 12. And then the second one is a little bit closer to that September 6th due date. So the second one is August 14th, same time, 11 to 12 p.m. So we have staff on the line. If you just want to call in and just listen to, a lot of folks like to do that. Yeah, feel free to do that. I'll also add, I think for our August meeting, we will have a Q&A time, but that doesn't really function as an office hour. We'll basically stay on the line for maybe 10-15 minutes if people have questions, but if folks don't have questions, then we'll just wrap up the meeting early. So it's only at these 2 office hours, like we will be there the entire hour. And with that, I think that brings us to the end of our tag. Our next meeting is August 28th. We will go over what to expect for the data validation process and timeline. So remember, data files are due September 6th. I hope I have that date right. I'm pretty sure it's September 6th. There is not too much that has changed, I don't think, about the data validation process, but we'll go over that in case you have new staff. During that month, which starts next week, we'll also start reaching out to payers to go ahead and start scheduling your validation meetings. And get that started. I think that went really well last year, and we were able to wrap up a lot of files and a lot of payers doing our validation process that way. So with that, this is schedule, and we'll go ahead and wrap up this tag meeting. Well, I'll hold for any questions. Does anybody have any questions before we finish up? And is there anything in the chat, Sam?
Nothing in the chat. Maybe everybody's just waiting for the office hours at 11.
Okay.
Everybody's really excited about that.
Super. Okay. Yeah, we will have office hours at 11. So if you want, let's see, it's not even 10:30. So that concludes our tag. Thanks, Kay, for recording. And if people want to take a 30-minute break and come back for office hours, we'll start that at 11. We'll keep this slide up.